Right now, stand up. Stand naturally, the way you would stand in line at a checkout. Place your hands on your hips. Slowly arch your back, leaning your upper body backward, lifting your chin and looking toward the ceiling. Hold that position for 10 seconds. Pay attention to your legs, not your back, your legs. If during those 10 seconds you feel a buzzing in your calf that was not there a moment ago, a tingling that creeps down the back of your thigh, a heaviness in your foot, or a pins and needles sensation that flickers on the moment you lean back, I need you to keep watching. Now sit down. Slump forward. Place your elbows on your thighs and let your head hang for 10 seconds. Notice what happens. The buzzing eases, the tingling retreats, the numbness softens. The sensation you just produced and dissolved in 20 seconds is not your blood flow turning on and off. Blood flow does not change that quickly with that little movement. What you just demonstrated is that the nerves running down into your legs are being mechanically squeezed by your own spine, and that squeeze gets worse when you stand tall and eases when you fold forward. The numbness in your legs is not a circulation problem. It is not just age. It is not, in most cases over 50, the beginning of diabetes. In about 75% of people over 50 with this pattern of leg numbness, the underlying problem is happening in a space inside your lower back that is roughly the size of a pencil eraser, where nerves the thickness of a piece of spaghetti are trying to thread their way out to your legs through an opening that has slowly, quietly closed in on them. And the muscles that decide how much room those nerves have are the ones nobody ever told you were the gatekeepers. Let me show you exactly what is happening in the bottom 3 inches of your spine. The ligament you did not know thickens with age, and the 2-minute habit that gives those nerves their space back. Subscribe to Dr. Michelle Park. Every person who joins makes it more likely the next person who has been told it is just circulation actually finds this information. You know the moments I am talking about. You stand in line at the grocery store for 10 minutes, and your calf starts to buzz. You walk through a parking lot, and by the time you reach the door, your feet feel like they belong to someone else. You stand at the kitchen counter making dinner, and you find yourself shifting from foot to foot, leaning on the counter, anything to take the pressure off. You get up from bed in the morning, and the first 10 steps feel like you are walking on cotton. You notice you have started using the shopping cart as a walker, leaning forward over the handle, and to your surprise, you can walk further that way than you can walk standing up straight. When you mention any of this at the doctor, the answer is almost always the same. They check your pulses in your feet. They feel for warmth. They listen to your arteries. They say the words, poor circulation, hand you a prescription for a blood thinner or a cholesterol pill, and tell you to walk more. So you take the pill, you push yourself to walk, and the numbness barely changes. Because in most people over 50 with this pattern, the blood was never the problem. Let me fix that. There are 2 completely different systems running down each leg, and they produce nearly identical symptoms when they fail. One is the arterial system, the blood vessels carrying oxygen to the muscles. The other is the nervous system, the wiring carrying signals from the spinal cord. When arteries are blocked, the muscles cry out for oxygen during use, and the pain stops the moment you stop moving, while standing. When nerves are pinched at the spine, the symptoms are produced and worsened by the position of the spine itself, not by the workload of the muscles. They get worse with standing tall and walking upright. They ease the moment you sit, lean forward, or pull your knees toward your chest. That single pattern, worse with extension, better with flexion, is the clinical signature of nerve compression, and a blood thinner cannot reach a pinched nerve. Your lower spine has 5 vertebrae, stacked one on top of the other, each separated by a soft cushion called a disc. Running down the middle of the column is a tunnel called the spinal canal, which carries the spinal cord and the bundle of nerve roots called the cauda equina, literally the horse's tail, because that is exactly what it looks like. At every level of the spine, two nerves branch off the cord and exit through a small side opening called the foramen, one on each side, to travel down into the leg. The two most important levels for leg symptoms are L4-L5 and L5-S1, the bottom two segments of the lumbar spine, the part of your back just above the belt line. In a young, healthy spine, these foramen are wide open windows. The nerves slide through with millimeters of room to spare on every side. The discs are tall and well hydrated, propping the vertebrae apart and keeping the windows open. The ligament that lines the back of the spinal canal, called the ligamentum flavum, is thin and elastic. As you bend, twist, stand, and sit, the openings change shape slightly, but the nerves always have room to breathe. Now watch what happens when you age. The discs lose water. They flatten. The bones above and below the disc move closer together. The foramen, the window the nerve has to exit through, gets smaller from above and below. At the same time, the ligamentum flavum thickens. Decades of small inflammatory insults cause it to lay down more tissue. By 60, that ligament can be 2 to 3 times its original thickness. It starts to bulge into the spinal canal from behind. From the sides, small bony growths called osteophytes, sometimes called bone spurs, begin to encroach on the foramen as the body tries to stabilize a sagging joint. The window the nerve used to glide through has slowly become a slot. Slot becomes slit. Slit becomes a pinhole. When you stand and arch your back, the back of the vertebrae press together. The foramen narrows further. The thickened ligament folds and bulges inward. The pinhole nearly closes around the nerve. The nerve fires the only signals it knows how to fire when squeezed: tingling, numbness, heaviness, buzzing, weakness. When you sit and lean forward, the back of the vertebrae spread apart. The foramen opens. The ligament unfolds. The nerve has room to breathe. The symptoms ease within seconds. This is why you can walk forever in a swimming pool, but not across a parking lot. Why you can ride a bicycle for an hour, but cannot stand at a kitchen counter for 10 minutes. Why you instinctively lean on the shopping cart. Your body has been trying to tell you for years what the problem is. You just did not have the vocabulary. 3 things happen at once after 50. First, lumbar discs lose roughly 20% of their height by 60 and up to 30% by 70. The foramen narrows simply because the bones are closer together. Second, the ligamentum flavum thickens, sometimes dramatically, particularly in people who have spent decades in extended postures, lifting, gardening, or standing with a swayback. Third, and this is the part that almost no one talks about, the muscles that control the tilt of your pelvis quietly weaken or shorten. Tight hip flexors at the front of the hip pull the pelvis forward into anterior tilt, which dramatically increases the curve of the lower back, which dramatically narrows the foramen. Weak, deep core muscles, particularly the transverse abdominis, fail to counteract that tilt. The result is a spine that lives in a state of constant extension, with the nerve openings pinched closed for 14 or 15 hours a day. The space stops being there, and the nerves stop being quiet. Before I go any further, I need to draw a clear line. There are situations where leg numbness or weakness is not chronic nerve compression and is a genuine medical emergency. You need to recognize these. Stop this video and get to an emergency room or your doctor today if any of the following apply to you. Sudden loss of bladder or bowel control combined with numbness in your groin area or inner thighs, the area that would touch a saddle if you were riding a horse. That pattern is called cauda equina syndrome. It is a true surgical emergency and every hour matters. Go to the emergency room. Do not wait for an appointment. Sudden, progressive weakness in a leg or a foot, especially the inability to lift the front of your foot when you walk, called foot drop. That can indicate a nerve root being acutely compressed, and it needs imaging this week, not next month. One leg that becomes suddenly cold, pale, painful, and has no pulse you can feel at the ankle or behind the knee. That can be an acute arterial blockage. Get to an emergency room today. Numbness that came on suddenly along with weakness on one whole side of your body, a drooping face, slurred speech, or sudden confusion. Call emergency services. That is stroke territory. If none of these describe you, if the numbness in your legs has been gradual, comes and goes with position, is worse with standing and walking upright, and eases when you sit or lean forward, then what follows is for you. There are essentially 3 patterns of chronic leg numbness after 50. They feel similar from the inside and have completely different causes. Pattern 1 is vascular, true poor circulation, called peripheral artery disease. The hallmark is pain or cramping in the calves that is brought on by walking and relieved by stopping while standing still. The legs may feel cold, the foot pulses may be weak, the skin on the lower leg may be shiny and hairless. This is real, this is dangerous, and it needs vascular evaluation. But it is the minority pattern after 50, not the majority. Pattern 2 is neurogenic, nerve compression at the lumbar spine, often called neurogenic claudication or lumbar spinal stenosis. This is the one we are focused on today. The hallmark is symptoms that worsen with standing tall and walking upright, and improve dramatically with sitting or leaning forward. The pulses in the feet are normal. The legs are not cold. The skin looks fine. The numbness is positional. This is the pattern that the majority of people over 50 with leg numbness actually have, and it is the pattern most often misdiagnosed. Pattern 3 is peripheral neuropathy, damage to the small nerve fibers in the feet themselves, most commonly from diabetes, vitamin B12 deficiency, or long-term alcohol exposure. The hallmark is symmetric numbness in a stocking distribution, both feet, worst at night, completely independent of position. It does not change when you stand, sit, or lean forward. If the numbness is in both feet equally, has been there 24 hours a day for months, and does not respond to position, you are likely in pattern 3, and you need blood work for blood sugar and B12. Let me tell you about someone I will call Robert. 64 years old, retired contractor, spent 40 years on his feet pouring concrete, framing houses, climbing ladders. Walked into a clinic convinced he had circulation problems. His story went like this. For about 3 years, he had been struggling with what he called dead legs. He could walk maybe 150 feet across a parking lot before his calves, and the tops of his feet would go numb and heavy. He would stop, lean on a car or a railing, and within 30 seconds, the feeling would come back. He could keep walking. Same thing again at 150 feet. He told his doctor it felt like his legs were not getting enough blood. He had a Doppler ultrasound of both legs. His arteries were clean. He had an ankle brachial index test, completely normal. His feet were warm and pink with strong pulses. He was given a baby aspirin and a statin and told to walk 30 minutes a day. He tried. He could not. Every attempt left him standing in a parking lot somewhere waiting for his legs to come back. The thing that unlocked the diagnosis was something he said almost as a throwaway. The weird thing is that when I push the grocery cart, I can go the whole length of the store. It is only when I am walking around without anything to lean on that my legs quit. That single comment is so classic for lumbar spinal stenosis that physicians have a name for it. They call it the shopping cart sign. When you lean forward over a cart, your lumbar spine flexes, the foramen open, and the nerves get their space back. Robert's circulation was fine. His nerves were being strangled at his lower back every time he stood up straight. Here is what happens to Robert's body every single day, and probably yours. He wakes up, lies in bed for a minute. The legs feel reasonable. The night spent in flexion-tolerant positions has given the nerves room overnight. He stands up. By the time he has walked to the bathroom, his lower back is already settling into its habitual sway. The pelvis tilted forward, the hip flexors pulling on a spine that has not warmed up. He stands at the sink to brush his teeth. The pinhole starts to close. He walks to the kitchen, makes coffee at the counter. By the time the coffee is ready, his calves are humming. He sits down at the table. The humming stops within 20 seconds. He gets up to take the dog out. The numbness comes back before he reaches the end of the driveway. He comes back inside, sits. The numbness stops. This is his entire day. Every time he stands, the openings close. Every time he sits, the openings open. He calls it his bad days and his good days, but they are actually his standing minutes and his sitting minutes. 2 tests. Right now, 90 seconds total. Test 1, the extension test. Stand naturally. Hands on hips. Slowly lean your upper body backward, lifting your chin and looking toward the ceiling. Hold the position for 10 seconds. If your leg symptoms appear or worsen, or you feel tingling, numbness, or buzzing that was not there before you leaned back, you have just reproduced your symptoms with spinal extension. That is a positive extension test, and it points strongly at foraminal narrowing. Test 2, the flexion relief test. Sit on the edge of a chair. Slump forward. Place your elbows on your thighs and let your head hang. Stay there for 30 seconds. If the symptoms in your legs ease, fade, or completely disappear during those 30 seconds, you have just reproduced the relief pattern that defines neurogenic claudication. Symptoms produced by extension, relieved by flexion. That is the clinical fingerprint of lumbar spinal stenosis, and most people are stunned to realize that they have just diagnosed themselves with 2 simple movements. The space is the problem, and the space responds to position. 3 things make spinal nerve compression worse. Most people over 50 do all 3 daily without realizing it. The first is prolonged standing with an arched lower back. The longer you stand with a sway back, the longer the foramen stay closed. This is why kitchen counters, slow checkout lines, and standing conversations are so brutal on the legs of someone with stenosis. A small fix, putting 1 foot up on a low stool or step while standing, tilts the pelvis backward, opens the foramen, and can buy you 20 extra minutes of standing time. The second is sleeping on your stomach. Stomach sleeping forces the lower back into deep extension for the entire sleep cycle. Your nerves spend the night being squeezed at the very level that already cannot afford to lose any more room. Most people wake up with worse symptoms after a night of stomach sleeping than they had at the end of the previous day. The fix is to sleep on your back with a pillow under your knees, or on your side with a pillow between your knees, both of which keep the spine in a neutral or slightly flexed position through the night. The third is sitting in deep, soft chairs. A couch that you sink into, a recliner that tilts your pelvis forward, a car seat with worn-out lumbar support, all of these allow your lower back to collapse into extension even while you are seated. You think you are decompressing because you are sitting, but the geometry of the chair is keeping the pinhole closed. A firmer chair with upright back support is, paradoxically, much kinder to a compressed nerve than a deep, plush one. Now the other direction. Things that support nerve space and nerve health. Water. The discs in your lower spine are 80% water in your 20s and as low as 65% in your 70s. Chronic mild dehydration accelerates that loss and makes the discs flatten faster. Aim for roughly half your body weight in ounces, spread through the day. A well-hydrated disc is a taller disc, and a taller disc means a wider foramen. Magnesium. Involved in nerve membrane stability and muscle relaxation. Low magnesium contributes to the irritability of compressed nerves, making mild squeezes feel like severe ones. Pumpkin seeds, dark leafy greens, almonds, and dark chocolate are the easiest food sources. B vitamins, especially B12, required for the integrity of the protective sheath around nerves. Deficiency is silent, common after 50, and especially common in people taking acid-reducing medications, which block B12 absorption. A simple blood test can identify a deficiency, and supplementation can dramatically reduce neuropathic symptoms over about 12 weeks. Walking with a slight forward lean on purpose. This sounds backwards, but in mild to moderate stenosis, walking with a deliberate slight forward lean from the hips, the way you would lean over a shopping cart, allows you to walk much further than walking bolt upright. As you build endurance, you can gradually decrease the lean. Walking is medicine for the spine. You just have to find the position that lets you actually do it. Now, the 2-minute habit that gives your nerves their space back. This is the core of the video. Pay attention. Every part matters. Evening, 90 minutes before bed. Lie flat on your back on the floor or on a firm bed, knees bent, feet flat. This is your starting position. Take a slow breath in through your nose and let your back press lightly toward the floor. First move, single knee to chest. Bring one knee up and pull it gently toward your chest with both hands. Pull until you feel a comfortable stretch in your lower back, not pain. Hold for 30 seconds, breathing slowly. Switch legs. Hold for 30 seconds. This is 60 seconds of pure foraminal opening, one side at a time. You are physically widening the windows your nerves exit through. Second move, double knee to chest with gentle rocking. Pull both knees toward your chest. Wrap your arms around your shins. Rock slowly side to side, just a few inches in each direction, for 30 seconds. The rocking massages the small joints of the lower back called the facet joints, the same joints whose stiffness contributes to nerve compression. Third move, posterior pelvic tilt with breathing. Place your feet flat on the floor again, knees bent. Place both hands on your lower belly. Slowly press your lower back into the floor by tilting your pelvis upward, as if you were trying to flatten the small of your back against the ground. Hold the tilt while you take 3 slow breaths through your nose, belly rising, ribs widening. Release. Repeat 3 times. Total time, about 30 seconds. This trains the deep core muscles, particularly the transverse abdominis, that are responsible for holding your pelvis in a neutral position during standing and walking. The full sequence takes 2 minutes. Right after the sequence, you will feel something most people are surprised by. As you stand up after the last pelvic tilt, you may feel a brief warmth that spreads down both legs. That is not your circulation improving. That is your nerves no longer being squeezed and their normal sensation returning to baseline. By the end of the first week, you will notice you can stand at the kitchen counter for 5 minutes longer before the buzzing starts. By the end of week 2, you can walk to the end of the driveway without your feet going numb. By week 3, the change is no longer subtle. You start measuring your day in feet again, not in benches. Robert did this protocol for 3 weeks. By the end of week 1, he could walk the full length of his block. By week 2, he walked the dog without stopping. By week 3, he made it through an entire grocery shop without leaning on the cart, and he stood there in the parking lot, surprised, because he had not done that in 4 years. His arteries had not changed. His prescriptions had not changed. What changed was that his spine was being given 2 minutes of decompression every night, and his nerves had stopped having to fight for room every time he stood up. 5 things to do tonight. 1. Do the extension test right now. Note whether arching your back reproduces leg symptoms. 2. Do the flexion relief test. Note whether leaning forward relieves them. The combination tells you, with high confidence, which pattern you are in. 3. Identify one place in your day where you stand for more than 10 minutes with no support, the kitchen counter, the bathroom sink, a checkout line, and put a low step or stool there to rest one foot on. 4. Tonight, 90 minutes before bed, do the full 2-minute sequence on the floor. Single knee to chest each side, double knee to chest with rocking, posterior pelvic tilt with breathing. 5. Tomorrow, check your sleeping position. If you sleep on your stomach, put a pillow under your hips to reduce extension, or start training yourself to sleep on your back with a pillow under your knees. Do this for 2 weeks. Retest. Walk the same parking lot, the same hallway, the same loop you have been struggling with. Time yourself or count steps. The change is not subtle. It is the kind of change you feel in your own legs the first morning you walk to the mailbox without your feet going dead halfway there. One last thing, I want to know 2 things before you go. How old are you? Write your age in the comments. The age of this audience shapes which topics I cover. And second, where are you watching from? Which city? Which country? Leave it in the comments. I want to see how far this conversation is reaching because it helps me understand who needs this kind of information most. And if someone you love has been quietly limited by leg numbness for years, has stopped going for walks, has stopped traveling because they cannot stand at airports, has stopped doing the things they used to love because their legs go dead at 150 feet, send them this video. They have almost certainly been told it is their circulation. They have almost certainly been handed a pill that does not address the real mechanism. You may give them the explanation and the 2-minute habit that gives them their walking life back. Your legs are not failing you. They are connected to nerves that are being squeezed by a structure that has slowly closed in on them, and that structure responds to position and to a few minutes of deliberate decompression every day. Give it 2 minutes, and the difference is not subtle. It is the kind of change you measure in driveways, in grocery aisles, in the moment you realize you have walked further than you have walked in years, and you forgot to be afraid.